What are the characteristics of calf muscle strain injuries in sport? Today I'm reviewing a 2019 study by Green et al. Which looks at calf muscle strains in elite athletes. We'll review this research and see how it could change our rehab decision making. Let's go. If you're new here, welcome. My name is Tom. I'm a chartered sports physiotherapist, and on this rehab review series, you can see videos on all of the latest rehab research. Subscribe down below so you don't miss anything new when it's posted. So this study from Green et al. Comes from Australia, and the basis of it was that little was known about epidemiology and recovery timeframes of calf muscle strains compared to other common strain injuries. So their stated goals were to describe epidemiology in calf injuries in AFL players, look at the cumulative incidence of injuries per season, look at the characteristics of the injured players who had calf muscle strain injuries, look at training and match injury history immediately prior to the time of injury, and determine if the recovery time frame following a calf strain muscle injury was influenced by whether it was a first-time injury or a re-injury. Finally, they wanted to compare soleus and gastroc injuries, their mechanism of injury while running. So the information from this study should help you with better decision making in terms of recovery times, particularly differentiating between gastroc and soleus injuries, and who's at risk of re-injury. And of course, this is going to better inform you to make those important decisions when you're talking to the coaching staff about when is a player expected to get back to playing fully. So just a quick introduction to the AFL in case you aren't familiar. This stands for the Australian Football League. It's the elite professional competition of Australia rules football. It's a fast-paced contact sport played between two teams of 18 players on a large oval field. The game combines elements of running, jumping, catching, ball handling, and frequent tackling. The preseason begins in October, November and runs until March. And then there's 22 weekly matches from March. Matches have 4 quarters and players typically participate in around 80% of the match. In terms of the loading profile of a player in a match, combined running and walking, a player can exceed 13 kilometers per game. And in terms of high intensity running, which is defined as greater than 5 meters per second, they have more than 200 accelerations at this exertion. You may be thinking this is quite a niche sport. It's actually got a lot of overlap with many other sports. So for example, it's very similar to both rugby codes, rugby league and rugby union, in that it's a collision-based sport, a lot of frequent tackling, contested ball situations, and you're handling and passing the ball predominantly with your hands. It's got similarities with football in that it's got a lot of endurance and agility. There's also similarities with American football and Gaelic football, GAA, as well. So although this study just looks at AFL, you can definitely extrapolate some of the findings onto these similar sports as well. Okay, so let's look at how this study was designed. So this was a prospective study that looked at 16 of the 18 teams in the AFL. So it's a pretty comprehensive look at the sport at the top level. They looked at 4 seasons from 2014 until 2017. Any calf strain injury was reported to the STR-AFL, the Soft Tissue Injury Registry of the AFL. The injury had to be diagnosed by the team doctor or the physio, and it had to result in training modification or competition loss. So when the injury was recorded, they also picked up data in 4 different areas. The first one was player demographics, trying to look for, is there a characteristic of particular players that get these injuries and how long it takes them to get back. The second one, training history and matches played before the injury. Was there something that preceded the injury that gives a clue about who's at risk? The third one, injury circumstances. When did the injury happen? What was the mechanism of injury? Is it during sprinting? Is it during catching, throwing, being tackled? And finally, the fourth one, outcomes following injury. Were they able to return to play? How long did it take? Did they have a re-injury? Another interesting thing about this study is that they had MRIs done for the majority of players, and they were looking for a correlation between MRI and functional outcomes in terms of return to play. So basically, they're looking at the full injury profile of calf muscles. Is there anything that precedes the event? Are there certain groups who are more risk of this? They're trying to give us information about who we need to look out for in our teams who are at risk, what we need to factor in terms of our prognostics, and setting expectations for the player and the staff about when they can get back to full play. So let's take a look at the results. And in total, there were 149 players injured with 184 injuries. So 149 of those were new injuries, and then there were 35 re-injuries with a ratio of 81% new, 19% re-injuries. On average, each club had around 3 injuries per club per year. So this is something that the physios of these teams were seeing multiple times each season. The highest point for re-injury was within 2 months of the date of the original injury, which really reinforces that rehab needs to be completely finished. It also means that you can't completely relax after 2 months. There were still some injuries after that, so you need to continue on with your prehab, injury prevention, knowing that recurrence is something that can happen. Okay, let's look at the results in the difference between gastroc and soleus injuries. Soleus was much more prevalent. 84.6% of the injuries were soleus versus 11.4% for gastroc. I was actually really surprised by how much more soleus was injured compared to gastroc. The other muscles that were injured, tib post was 2%, peroneus longus, plantaris, and the Achilles tendon were all less than 1%. Almost all of the re-injuries were the soleus muscle, 91.4%. This is something really relevant that you've got to look out for when you are doing your long-term planning for your calf muscle strain patients. Let's go to the results of the characteristics of the injured players. And they found that re-injuries happened significantly more in older players, both in terms of chronological age, but also in terms of playing age. So the amount of years since they started playing the sport. So you really need to keep an eye on not just your chronologically older patients, but also those who've been in the sport the longest. Maybe you start really early, giving them extra prehab to take care of their calves, talking with the S&C coaches to potentially get a modification to their load in the off season. Okay, let's look at the second section, which is training and match history at the time of the injury. And they found that the worst month was the first full month of matches after the preseason. That's when there was the biggest quantity of injuries. Interestingly, there was no significant difference in those who had completed 80% or more of preseason compared to those who didn't. So not completing preseason wasn't actually a risk factor for getting a first-time injury. However, 70% of the re-injuries involved a player who had not completed 80% of the preseason. So those players who were not able to complete preseason, not so much thinking that they're at risk for a first-time injury, but definitely thinking that they're at a higher risk for a re-injury. Okay, let's go to the third section now, which looked at the activity of the time of the injury and the mechanism of injury. When and how are these injuries happening? Index injuries were most common during matches, whereas re-injuries were most common during training. Almost half of the index injuries did not have a readily identifiable inciting incident. So almost half of these injuries were gradual onset, or there was a non-specific event that caused them. So that's something that you need to be prepared for, that not all of these calf strains are going to be real obvious pulling up during a match. In those that did have an obvious inciting event, 15% came from acceleration and 14% came from steady state running. Those were the two main inciting events. Now, interestingly, in this aspect, when you compare soleus with gastroc, there was a much higher proportion of soleus injuries in steady state running and a much higher proportion of gastroc injuries in acceleration, just kind of tying in with what we know about how the muscles work. Okay, the fourth and final section was recovery after the injury, which is obviously really important for our prognosis and communication with the coaching staff. And there was a huge range of recovery times here, which ranged from 2 days to 102 days. So a huge difference in how long it took players to get back to full play. So on average, players with a re-injury took an extra 16.6 days to get to running at 90% or greater of maximum speed compared to index injuries. An extra 16.2 days to get back to full training, and an extra 18.9 days to get back to full return to play. So that's quite important. 18.9 days, we're almost approaching 3 extra weeks there. And considering that there's usually 1 match per week, that's an extra 3 matches. If we compare recovery following gastric injuries and soleus took longer in almost every single aspect compared to gastroc, apart from time taken to get to pain-free walking. But all of the other things that they looked at, soleus recovery took longer. So there's a trend for soleus to take longer, but none of these were significant. So that's important to note. One really interesting thing about the mechanism of injury, though, is that regardless of the muscle, injuries related to running, these took on average 33.4 days to return to play, whereas injuries that occurred during a non-running task, so kicking, jumping, landing, gradual onset, non-specific injuries, they had a significantly quicker recovery period, 21.3 days, and that was significant. So that's really important to know your mechanism of injury. If you've got someone who sustained their injury during running as opposed to a non-running task, you know that they're going to need extra time to get back to full recovery. Again, really crucial when you're communicating with the coaching staff, giving them realistic expectations. Older players, players with soleus injuries, players who sustain their injuries while running, these are all going to take longer to get back to the pitch. Another really important finding from this study was that over half of the re-injuries occurred within 2 months of the first injury. So there seems to be too much of a culture of rushing players back. This is pressure coming from the staff and from the player to get the athlete back on the pitch as soon as possible. And this is where you really need to be armed with this data about how long recovery takes so that you can argue your case that the player needs a little bit more time to reduce the risk of them being re-injured. These re-injuries are likely due to the injury not being fully recovered yet, not being able to take that maximal load that you need to perform in professional sport. Okay, so what did I think about this study? I think there's loads of really, really useful information here, and it's just reassuring to have all this data about the differences between gastroc and soleus, the mechanism of injuries, the age of the players. All of this can factor into how we can advise and estimate our return to play to the coaching staff, give them realistic expectations, also identify players who may be at a higher risk of picking up these injuries, and hopefully do some preventative prehab with them to reduce that risk. Also got to add in, I love this soft tissue registry of the AFL that they did. This seems to be like a sport-wide coming together of all the teams to record all of their injuries for the well-being of the athletes. I think a lot more sports need to adopt sport-wide injury recording platforms like this, because they give a really, really great insight into the individual demands of the sport. And I think if more sports had this altruistic mentality, pooling all of their injury data, a lot more injuries could be avoided. But unfortunately, there is a competitive nature in a lot of sports, or there's a lack of organization to organize a big database like this. Incredible that they were able to do something so comprehensive for 4 seasons using almost every single team in the top tier of the Aussie Football League. Okay, hopefully you found that interesting and you picked up a couple of tips that you can use. What did you learn from the study and what might you change about your clinical practice? Leave me a comment down below. Let me know if there's any really interesting studies that you want me to check out and analyze. Make sure you subscribe so you don't miss the next video when it pops up. Thank you so much for watching, and I'll see you on the next Rehab review.